MS is a complex and unpredictable disease. There are issues that can arise as a result of the treatment and because of the disease itself. It is therefore important to understand what these are and what you can do about them. This part of the programme is divided into 4 sections. It explains common side effects which can be experienced as a result of the injection and because of the treatment itself. We'll investigate immune reactions which can reduce the effectiveness of the treatment. We'll also look at relapses and we hear how patients have coped with them.
Okay, so you've got your pre-filled syringe here.
On any of the treatments, you may experience a reaction of the area injected. Research shows that this occurs in only around 3% of patients using the intramuscular treatment, but in 65 to 90% of patients using subcutaneous injections. The most common reaction appears as redness and swelling. If the skin becomes broken or painful, contact your doctor or MS nurse before continuing with treatment.
Injection site reactions can be quite common. They're less likely to occur with the intramuscular preparation. Your intramuscular sites are on your thighs. You can minimise the risk with good hand hygiene, good technique and rotating the site of injection.
One of the most common side effects of treatment with interferons is the onset of flu-like symptoms following injection. The symptoms are generally mild and manageable and usually disappear as treatment continues.
When I first started taking my treatment, I had side effects. They were similar to flu, aches and pains and a bit of the shivers. And I used to take paracetamol to get over that before I took the drug, and then I'd leave paracetamol next to the bed so that if I needed it in the night, I could take it. And what I actually did was take the drug on the day that I'm going to be off work so that it doesn't affect work and it doesn't also affect my family.
It's quite common to experience flu-like symptoms when first starting an interferon therapy. The symptoms can be reduced by taking over-the-counter pain medications such as paracetamol or ibuprofen. People taking glatiramer acetate seldom experience flu-like symptoms. However, very occasionally they can experience something akin to a panic attack. Now this presents itself as chest tightness or breathlessness. It can come on approximately 2 minutes post-injection and last up to 1 hour. If this should occur, try not to worry and discuss it further with your MS nurse specialist or your consultant neurologist.
An immune reaction occurs when your system tries to fight a foreign body such as a virus. Sometimes the injected interferon, being a protein, is mistaken for a foreign body, and so you develop antibodies to fight it. These are called neutralizing antibodies, when they prevent the interferon binding to the receptors, and so can prevent the beneficial therapeutic effects of the treatment.
All of the injectable treatments used in multiple sclerosis, the 3 interferons beta and glatiramer acetate, are capable of forming antibodies in the individual. Sadly, we have no way of knowing which people are going to produce antibodies. With glatiramer acetate, we have little evidence as to the effect of those antibodies when they occur, but with the interferons beta, we have reasonable evidence that when neutralizing antibodies occur in high concentration and persist for some time, they reduce the effectiveness of the drug. There seems no doubt but that the interferon beta-1a, which is given intramuscularly once a week, is least likely to form antibodies. Recent estimates suggest less than 5% of people, whereas with both of the subcutaneous interferons beta, given either every other day or 3 times a week, there is a risk of greater than 20% of antibodies being formed and therefore of some reduction in effect. And the reason for this may be related to the method of delivery and to the method of manufacture of those agents.
Although a relapse is an indication that disease progression activity is taking place within the central nervous system, it does not mean that the drug has stopped working. The drug helps reduce the number of relapses. How long a relapse lasts is unpredictable, and recovery can be slow and gradual or instantaneous.
Experiencing a relapse can be extremely upsetting. It's important to remember this doesn't mean that your therapy isn't working. You must continue on therapy and continue seeing your MS nurse on a regular basis for additional support.
Before diagnosis, I was having a regular relapse every 8 months. These symptoms were pins and needles, maybe eyesight problems, loss of taste, hearing. Since I've started on the treatment, I have had 2 relapses, and that's over the last 3.5 years. So it's certainly helping.
You did have some quite big eyesight problems in this last relapse, and I was answering emails for David and reading things to him. But you get round it, you do cope.
With vision problems in my left eye. After my last relapse, I went to see my specialist to discuss other options of treatment. He said that the treatment I'm on at the moment is less likely to produce neutralising antibodies, which affect the drug from working. So I've decided to stay on the once a week intramuscular injection.